So I'm about to go see Mr. Andrews, and as you can see on the sheet here, I've already looked at his medical record online and pulled off as much information as I can and kind of consolidated it into this handy sheet that I have and can use for multiple days. And so I fill out everything that I can except the physical exam findings and how he's done overnight, and then also the plan. So I wait to do those two things after I see the patient, of course. So let's go see him.
Man.
Good morning. Are you Mr. Andrews?
Yes, I am.
I'm Madison Spriggs. I'm the medical student on the medicine team that you're on. I was going to come visit with you this morning and see how you're doing.
Okay, I appreciate it.
So I read through your chart, and I know you probably told your story 100 times, so I'll just kind of recap what I read, and at any point, if I have said something that's incorrect or you want to clarify, please interrupt me, okay?
Okay.
Okay, so as I understand it, you came into the ER by ambulance yesterday afternoon, and you really just hadn't been feeling well for about a week. Had this cough, and when you were coughing, having chest pain associated with it, and also started coughing up nasty green stuff. Yeah, and maybe some fever at home, but just not getting better. But bad enough that you felt you needed to call the ambulance to bring you in, and it's good you did. So you got here and you did have fever, and I think the ER people probably talked to you about that you had some infection, it looks like, and pneumonia in that left side. So compared to yesterday in the ER, how are you feeling now?
I feel better than I did yesterday.
Good, good. Are you finding it a little easier to breathe with the oxygen on?
Yeah.
Good, good. Have you had many of the respiratory treatments with the albuterol?
I think I had one last night.
Okay, did you feel like that helped?
Yeah, a little bit.
Okay, so those are set up what we call PRN, so you have to ask your nurse for that specifically. So if you felt like it helped or you feel like you need another one, you can ask for it, and you can get it every hour. How's your pain been?
Oh, a little bit. Not.
Is it still only when you cough?
Yeah, pretty much.
Okay.
When I aggravate it. Yeah.
Okay, so you do also have pain medication for that, but again, you have to ask for it. We want you to be as comfortable as you can be. What questions do you have for me?
Can I get up and go to the bathroom?
Well, right now you have a Foley catheter in, so you can go to the bathroom whenever you feel like you need to, and we'll probably get that out today. I'll have to talk to my boss, Dr. Tarek, and see, but I think we can go ahead and get that out today, and then you can get up and go to the bathroom, and we'll probably put a bedside commode in here for you so that you don't have to go very far, because I know you're still hooked up to the IV and everything. Oh, your alarm's going off. Let me turn that off. They always go off. So I'm just going to hit the silence button, and then whenever I leave out of here, I will let your nurse know that it's alarming, because I don't know how that works. But
What does that mean?
well, I'm not sure. I just know that it can be really annoying and it can interrupt trying to talk to you and do your physical exam. But I will, as soon as I leave out of here, I'll go tell the nurse that it's alarming.
Okay.
And that way you don't have to listen to a beep.
Thank you. When do you think I get to go home?
What we typically do is we like to see that you haven't had a fever and that you are getting better, and we can see that improvement over the course of at least 24 hours. And then we'll get you off the IV antibiotics and get that IV out of you, because I know that that's not fun either. And get you on oral medication that you can take at home. So that's typically our plan. And we have to get you off the oxygen too. So we have to get your pneumonia better well enough that you don't need the oxygen either.
Okay.
So that's typically how things go. But it all kind of depends on how you do as far as symptoms and how you're feeling.
Okay.
Okay, so if I could get you to sit up and I'll help you so I can listen to your lungs.
Okay.
Let me just get you to take a breath. Very good. Again. And one last time for me, please. So I hear crackles now. And let me get you to say the letter E.
E.
One more time.
E.
And one last time, please.
E.
Okay. I'm going to listen to your heart. I'm going to untie the top of your gown here.
Okay.
And you'll feel me kind of press down, okay? Okay. You can sit back, sir.
Okay.
Thank you.
Thank you.
So everything on exam kind of sounds exactly like we'd expect with hearing the pneumonia in that left lower side. But your heart sounds good. I don't hear any other things that would be abnormal.
Okay.
Do you have any other questions for me? Nope.
No, I don't think so.
Okay, so I'll warn you, whenever we come around, they're typically like 6 to 8 of us, and we're gonna be look like a football team in white. So I don't want it to be, it can be a little intimidating for patients who aren't used to a hospital setting. So just so you're aware, it can be a little scary, but you're still welcome to ask questions and everything, okay?
Okay.
Okay, thank you so much, and I'll see you in a little bit.
Okay.
Bye.
Thank you.
So now that I've left the patient's room, I like to do just a mental checklist to make sure I've covered everything. I want to be sure I've actually done all of the pertinent physical exams. I want to look and see if the patient had a Foley in. I want to check to see how many liters of oxygen they're on and if they are receiving any kind of DVT prophylaxis. So now I'm going to write my physical exam findings on the sheet that you saw earlier and make a plan. Then I'll write my SOAP note in Epic.